I guess the things that we found very interesting about it, it's quite engaging. It's quite engaging for the doctors. We have doctors who do a range of activities, but most of it's built around consulting or around small time procedural work. So doctors sometimes get very stale, particularly when they're telling the same story multiple times in the week about a chronic condition. So the classic examples being smoking or diabetes, weight loss, this type of thing. We're often telling the same story to different people. And there's a range of pressures also get applied to doctors, and doctors tend to operate in isolation. They operate in a room behind a closed door with an individual. So there's quite a bit of variation in the information that gets imparted to different people at different times for the same condition. So when we put a group of people in a room and have a shared medical appointment, I guess some interesting things start to happen. One is that the doctor is going over a series of pieces of information with those 8 or 10 people over in an environment where an idea or concept will be teased out. So they might start with the first patient and talk about how how their diet affects their sugar levels, and then the next person might talk a bit about how their medication brings their sugar levels down. The next person might talk about how they've had side effects from the medication. The next person might come back to the diet and then bring up something that no one else has thought of, and the doctor may pick up an interrelationship then with the medication and the diet, and we start to bring things together. So what happens is that this group of people, instead of getting 10, 5 or 10 minute interactions around their condition, they actually get 60 to 90 minutes of interaction around their condition. And so there's a lot of information. Now, because there's a lot of information and each individual is having an individual consultation in the process, it starts and restarts again and again. And I think there's a sort of, I would call it like we're laminating information. We're building information on information. And so we're finding that the people who go to it, the feedback we get is that they're very, they feel that they're learning things and hearing things they haven't heard before. There's some interesting things too about the credibility of the doctor. Because we do these shared medical appointments we've got a doctor, we may have a nurse or diabetic educator or psychologist in the room facilitating, and we often use one of our clerical staff to take notes and things in the process as well. So the thing is that the doctor is actually interacting in a room full of people. There's 8 or 10 patients, there's another health professional, and there's our staff who are associated. So the doctor, in a lot of ways, his or her credibility is much more on the line. They've actually got to be knowledgeable, credible and accurate with what they say, because they're much more held to account than they are behind a closed door with a single person where they may not have knowledge.